Hello and welcome to my channel Passionate PT. Today I'm going to discuss about one of the primary complications of the patients of spinal cord injury, and that is autonomic dysreflexia. So let's start. So as the name suggests, autonomic dysreflexia, so this is something related to autonomic nervous system. That means autonomic nervous system has difficulty in producing its reflexes. Because autonomic nervous system is involuntary, we cannot have a control on this system, so that is why it is known as reflexia, dysreflexia. That means difficulty in producing the response. Now before starting this, that what is included in this phenomena, the most important thing is to understand the autonomic nervous system. I will try to give a brief overview of the autonomic nervous system in this video and how it is related to autonomic dysreflexia, but I'll suggest that if you can go in a bit detail of autonomic nervous system, that will be far more good, but I'll try to explain as much as possible in this video to the extent it is related. But this is a brief again overview, and if you find any mistake, then apologies for that, you can correct me in the comment section. So autonomic nervous system comprises of two systems, sympathetic nervous system and parasympathetic nervous system. Sympathetic nervous system works in stressful situation and parasympathetic nervous system works in peaceful environment. So you can memorize it by that S sympathetic, S for sympathetic, S for stressful, and then P for parasympathetic and P for peaceful. Okay, so what they are, sympathetic nervous system is present in the thoracic and lumbar region. That means that ganglions for sympathetic nervous system are present in starts from T1 and ends at L2. That means they are present in whole of the thoracic region and extends up to L2. Okay, fine. And then in the parasympathetic nervous system is present in the here I've made a random figure. It's present in the brain stem and in the sacral region. So parasympathetic nervous system comprises of fibers from cranial nerve 3, 7, 9, 10 and sacral levels of S2, S3 and S4. So this is what is their location. Now sympathetic nervous system, as this work in stressful situation, it is primarily controlled to to becoming it over efficient. Parasympathetic nervous system has a strong control or influence on the sympathetic nervous system. So what happens? Okay, let's first discuss that how sympathetic and parasympathetic work during the stressful situations. For example, in the case you see a danger, in case of lion or dog or anything that can harm you and you want to run away from that danger, you need a sudden lot of energy, lot of power to run. Okay, so in that stressful situation, sympathetic nervous system will be activated. What it will do, it will dilate your eyes so that you can have a better vision of your environment. It will dilate your bronchi so that you can have more air inside your lungs, you can inhale more oxygen. It will increase your heart rate so that you can have a more delivery, a very nice delivery of blood to your needed muscles. Okay, then it activates liver for increase synthesis of glucose and all that. But it inhibits the GIT, in other words it inhibits stomach, because at the time of stress, when your only purpose is to save your life from danger, you don't need to digest your food at that time, so it will inhibit the stomach functioning. Okay, I'm giving a very big points, then it'll also affect your bladder and genitals. It'll cause urinary retention, because you do not need to maturate, you do not need to urinate at that point. So all the unimportant function at that point will be inhibited, and all the important function, that will primarily your heart, lungs, it will activate those. So what it will do, it'll keep activate the body in fighting situation. But once the danger is gone and you need not to be that in fighting situation, then parasympathetic nervous system will play its part. What it will do, that it will constrict your pupil. By constriction, that means it will return the pupil to normal level. It will constrict the bronchi, and by that again means that it will bring the bronchi or the lungs to their normal level. It will reduce the heart rate, and similarly all other function, it will regenerate the function to their normal functioning. So for the parasympathetic, the word is used as rest and digest, like it brings the body to resting state and helps the body to perform its other function of digestion, defecation, micturition, all that. These two systems have a very wide effects on almost every part of the body, every organ of the body. So I have just made simplest in a simplest way possible to make this phenomena understandable. Now what happens here, if you see at sympathetic nervous system, it is here in the center, in the thoracic and the lumbar region. Okay, here in the brainstem and at the sacral region, means above and below, is the parasympathetic nervous system. In the center is the sympathetic nervous system. From T1 to T5, sympathetic nervous system has an impact on the organs above the abdominal cavity, like lungs, heart, eyes, okay, and all other, pharynx, larynx, and all that. It has impact on all the organs situated above the abdominal cavity. Here starts the abdominal cavity. Now from T6 to down, sympathetic nervous system has impact on the abdominal cavity, on the bladder, rectum, and all the organs lying below that level, below or within the abdomen. Okay, now what happens here, when sympathetic activity is over, when no more running is needed, parasympathetic nervous system comes into play. Hairs being situated above and below, it inhibits the sympathetic nervous system from performing any more activity. That means it inhibits the sympathetic nervous system from dilating the eyes and dilating the bronchi and increasing the heart rate and increasing the blood pressure of all these organs. Parasympathetic nervous system stops or slow down sympathetic nervous system. And how does it perform that here it is located. Here is the I've drawn separate figure, but if you can see it here it is located parasympathetic. What it does is that it sends signals from the brainstem towards the thoracic and lumbar region and tells the sympathetic nervous system to stop acting and stop performing. First, this method is known as direct inhibition. Okay. Secondly, what it does, that as it has cranial nerve 10 being its part, it activates cranial nerve 10th cranial nerve. What that is activated for, that to reduce the heart rate and to cause the vasodilation. Okay, this is the second method is to reduce the heart rate. Okay, by this method it inhibits the sympathetic nervous system. And third method is by performing vasodilation and again inhibiting the sympathetic nervous system. What sympathetic nervous system does, that it vasoconstricts and increase the blood pressure of all the vessels which it supplies. Okay, and parasympathetic nervous system causes vasodilation and reduces the blood pressure. So once sympathetic nervous system is activated, it is important after danger is gone, for the parasympathetic nervous system to come into play and tells the sympathetic nervous system that now the danger is over, please let the body come to its normal and peaceful level. Now what happens, you need to keep in mind those 3 points mainly, that parasympathetic nervous system sends the signal directly from brainstem towards the cord to inhibit sympathetic nervous system. Secondly, it activates its 10th cranial nerve to slow down the heart rate. And thirdly, it vasodilates by using 10th cranial nerve the vessels to reduce the resistance and reduce the blood pressure. Now where the problem happens, in patients with spinal cord injuries who mostly have an injury above T6. Okay, now I've explained previously that up T1 to T5 the control is on all the organs situated above the abdominal cavity. From T6 to down, the control is on the abdominal and on the abdominal organs in broad term. Okay, now when the injury is above T6, okay, the injury is above T6, the when sympathetic system is activated, and then after activation, when parasympathetic tries to inhibit it or stop it by directly inhibiting it from the brain stem, due to injury at T6, the sense signals from the parasympathetics being situated at the top does not travel through the level of injury to tell the sympathetic that please stop now, do not increase further blood pressure and all that, do not increase the heart rate. So the sympathetic nervous system keeps on increasing the heart rate and keeps on increasing the blood pressure of all the vessels situated in the abdominal area. What next? Then the parasympathetic nervous system uses the second method of vagus nerve to slow down the heart rate. Vagus nerve slows down the heart rate, but that is not that much helpful to reduce the blood pressure which is being increased over here. Now here the above segment T1 to T5 reduces the blood pressure of its concerned organs because the above region has got the signal from the parasympathetic, but the part of this system that is present below the level of injury has not received the signal from parasympathetic nervous system, so it keeps on increasing the blood pressure and causing the vasoconstriction. So above the T6 there is vasodilatation and below the T6 there is vasoconstriction. So vasoconstriction being in the major part of the body results in overall a tremendous increase into the blood pressure of the patient, and this causes the patient to have hypertension. That hypertension, as you all know, increase in blood pressure can have devastating effect. It can cause hemorrhage, it can cause again stroke or any other injury in any part of the body. So this phenomena is known as autonomic dysreflexia. In other words, parasympathetic nervous system loses its control on sympathetic nervous system. Sympathetic nervous system keep on activating the body system to increase the blood pressure, resulting in massive hypertension that can have a devastating effect. Now, why this happens and how does it happen? The main initiating factor for starting this phenomena is the bladder and anything that irritates the body or puts the body in stress, like painful situation. In the case of spinal cord injury patient, there can be bladder and bowel distension, irritation, presence of any kidney stone, pressure sores, or any other any electrical stimulation, or any other thing. Anything that brings the body to painful situation will generate or will initiate this phenomena, and the main culprit are considered as bladder and bowel irritation. Now, how you will come to know that the patient is going through the phenomena of autonomic dysreflexia? The main signs are, the main resultant devastating effect of this is increase in blood pressure or hypertension, and that is 20 to 30 millimeters of mercury above the resting. Okay, now because the parasympathetic nervous system is constantly trying to reduce the blood pressure by reducing the heart rate through the vagus nerve, it can also cause the bradycardia. Okay, patient can show the symptoms of pounding headache, blurred vision, and because above the level of injury there is vasodilation, there can be flushing, and below the level of injury there is vasoconstriction, so there is pale skin below the level of lesion. So this can they can be other symptoms as well. So main culprit, or the main resultant issue is the hypertension. Now what, and this phenomenon, autonomic dysreflexia, appears in chronic stage. In other words, when the most of the time patient is being discharged at home, it can appear. So we mostly we mostly educate the patient about this. We tell the patient that what they need to do if this happens. So what we mostly educate the patient is to tell them that if such type of phenomena you feel is happening, look for any triggering issue, any painful thing that the patient may be going through that can initiate this. Like look for, even tight clothing can initiate this, any pressure sore, any urinary retention or fecal impaction, or anything that is placing the patient in stress can initiate this phenomena. So we educate the patient and tell the patient to call the emergency for this. Now I would like to discuss another complication of this, and that is spinal shock. Spinal shock is actually, because of lack of space, I've not written about the spinal shock, but there's some brief overview and there's brief description which I want to give about spinal shock. Is that spinal shock is something, as again the name suggests, that it is related to spinal cord that will come into shock. Soon after the injury, spinal cord injury, the spinal cord goes into shock. That means all of the reflexes, whether autonomic or superficial deep, any reflexes, all suddenly disappear and patient is in the state of shock. Spinal shock